Welcome to another deep dive. Looks like you're really interested in keeping up with the latest in health and wellness.
Yeah, you've given us quite the reading list this time.
We've got an article on allergic rhinitis, something on new things causing allergic contact dermatitis,
A study on eye complications with new medications,
research on managing leg cramps.
and even a study on beta blockers and Huntington's disease.
Let's jump in.
Sounds good.
Okay, well, it seems like you flagged a lot of articles about allergic rhinitis, or AR, as the experts call it.
Yeah,
And I was surprised to learn that it impacts up to 40% of people.
it's a very common condition.
I always thought it was just, a stuffy nose. But it seems like it's a lot more than that.
It can be. It's definitely linked to other things like asthma and even conjunctivitis, and even how doctors think about and classify AR has changed.
Oh, really? So I remember, growing up, it was always, oh, you have hay fever.
Right.
It was always a seasonal thing.
Yeah, that old seasonal versus perennial distinction is a bit outdated now. Doctors now classify AR based on how long your symptoms last and how severe they are.
Huh.
So it's a more kind of nuanced approach that reflects that fact that a lot of people can have allergies year-round.
Yeah, it makes sense. I mean, you could have, if you have multiple allergies, different things could be popping up at different times a year.
Exactly.
What about these less common types of rhinitis that the Allergic Rhinitis Review mentions? Occupational and local allergic rhinitis, what are those all about?
So occupational rhinitis is when you're actually exposed to something in your work environment that triggers the allergic reaction. So, for example, lab workers or veterinarians, even bakers, could have occupational rhinitis.
Okay, so it's not just about pollen dust.
Exactly.
It can be things that we're exposed to at work.
Right. It's a good reminder to think about your environment and your potential triggers. And then local allergic rhinitis, or LAR, is kind of interesting. It's like an allergy that's just in your nose.
What?
So you're exposed to certain allergens, your nose reacts, but you don't show the typical sensitization on allergy tests. So it's like this local reaction in the nose without the rest of the immune system being fully on board.
So even if my nose is acting up, it doesn't necessarily mean that I'm destined for full-blown allergies.
Right. LAR is its own thing. It really highlights how much we still don't know about how the immune system works.
Speaking of not knowing, the review mentions that even doctors sometimes miss AR.
Yeah.
It can be easy to just dismiss it as a cold, especially if symptoms come and go. If you ever thought that, you know what, maybe I've had this.
It's a possibility for sure, and if you have these recurring symptoms, it's something to think about. The Allergic Rhinitis Review actually goes through the steps that doctors take to diagnose it, starting with a really detailed history.
Okay, so more than just when did you start sneezing?
Exactly. They want to know everything. Your family history of allergies, your environment, what medications you're on, all that stuff. It's about getting the full picture to try to pinpoint those potential triggers.
And then there's the physical exam. What are doctors looking for specifically when they're examining someone they suspect might have AR?
So they're looking for signs of inflammation in the nasal passages, things like swollen mucous membranes. They might even look for something called allergic shiners, which are dark circles under the eyes caused by nasal congestion.
Oh, allergic shiners. I've never heard that term.
It's more common than you think. And then, of course, there's allergy testing.
Right. I remember as a kid, those skin prick tests.
Oh, yeah.
Not fun.
Not fun. But so those are still widely used. But there's also a blood test that can be done called in vitro IgE testing.
So what's the difference? Is one better than the other?
Well, they both have their pros and cons, and cost may be a factor too. Skin prick tests, they involve pricking the skin with a tiny bit of the allergen and looking for a reaction.
Right.
In vitro IgE testing actually measures the amount of allergen-specific antibodies in your blood. So, yeah, it's worth discussing with your doctor which type of testing is right for you.
Okay, so let's say you do have AR. What's next? What can you do about it?
Well, the good news is there are lots of treatment options.
Okay, let's break them down. First up, allergen avoidance. Sounds pretty self-explanatory. Stay away from the things that make you sneeze, right?
In theory, yes, but it can be much harder than it sounds.
Right.
Especially depending on your triggers. If you're allergic to pollen, you can't just stop going outside.
Right, true. But the review does give some good tips, like using dust mite covers on your bedding.
Yeah.
Controlling humidity levels to reduce mold, investing in some good air filters.
Those are good practical tips. And the review also mentions nasal saline irrigation as a simple but effective treatment.
Is that just rinsing your nasal passages with salt water, like using a neti pot?
Exactly. Safe, effective, inexpensive, and it can even reduce the need for medication.
That's good to know. But sometimes you do need medication. And the review covers a whole range of options, from antihistamines to corticosteroids to something called immunotherapy.
Let's start with second-generation antihistamines. These are often the first line of defense. You've probably heard of some of them. Arius, Allegra, Claritin.
Yes, and they don't make you drowsy like those old antihistamines did.
Right, much better safety profile. But even with these newer antihistamines, the allergic rhinitis review makes it clear that they're not as effective as intranasal corticosteroids.
Intranasal corticosteroids, that sounds kind of intense.
It's just the medical term for nasal sprays that contain corticosteroids, which are really powerful anti-inflammatories. They work by reducing inflammation directly in the nasal passages.
And I've always heard that corticosteroids can have some, pretty bad side effects.
They can, and that's why it's so important to use them correctly as directed by your doctor. The review does mention potential side effects like nasal irritation and for some, possible growth effects in children.
So something to discuss with your pediatrician if your child needs them. What about those combination intranasal corticosteroid antihistamine sprays? What's the advantage of those?
Well, those combine the anti-inflammatory power of corticosteroids with the symptom relief of antihistamines, all in one spray. They're even more effective than using both components separately, and they can be a good option for people with more persistent or severe symptoms.
Okay, so that covers antihistamines, corticosteroids. What about those leukotriene receptor antagonists that the review talks about?
Yeah, those might sound complicated, but they're just another type of medication that targets the inflammatory process. Montelukast, sold under the brand name Singulair, is one example.
Okay, so how do they compare to those intranasal corticosteroids?
They're not as effective, but they can be useful for things like nighttime symptoms or if you have coexisting asthma. The review does point out potential neuropsychiatric side effects, particularly in younger children. So close monitoring is necessary.
Okay, on to what seems like maybe the most exciting treatment option, allergen immunotherapy.
Yeah.
It's not just about masking symptoms, it's about retraining your immune system.
Right.
I'm kind of intrigued by this one.
Yeah, me too. There are two main types. There's subcutaneous immunotherapy, or SCIT, which involves injections. And then there's sublingual immunotherapy, or SLIT, which uses tablets or drops that dissolve under your tongue.
So with SCIT, you're getting regular injections of small amounts of the allergen.
Right. The idea is to gradually expose your immune system to the allergens so you react less severely over time.
And SLIT seems a little less intimidating, no needles involved.
No needles, you just dissolve a tablet under your tongue daily.
Hmm,
And the review really highlights the convenience and the safety profile of SLIT.
okay.
You might have some mild side effects at first, like an itchy mouth, but those usually
Mhm.
go away after a week or so.
Okay, it sounds pretty promising. But for both SCIT and SLIT, you need to do it for a few years to get lasting benefits, right?
Yes. The Allergic Rhinitis Review recommends at least 3 years of immunotherapy for the best results. And it's also generally considered safe during pregnancy after the initial dose escalation phase.
That's good to know. The review also touches on some less common treatments like decongestants, oral corticosteroids.
Yeah, decongestants can provide some short-term relief, but, they can cause rebound congestion if you use them too long. And oral corticosteroids are usually reserved for severe cases that don't respond to other treatments.
And finally, there's the topic of complementary and alternative medicine, or CAM.
Yeah, a lot of people are interested in CAM.
A lot of people swear by their herbal remedies or acupuncture. What does the review have to say about that?
It's a very popular topic, but the review is pretty clear. There's not enough scientific evidence to recommend CAM for allergic rhinitis.
Okay. I know a lot of people would disagree with that. Is there really no evidence, or is there just not enough strong evidence?
While some people may find those treatments helpful, it's important to remember that natural doesn't automatically equal safe or effective.
Mhm.
And it's always crucial to talk to your doctor about any CAM treatments you're considering.
That's a good point. Well, we've covered a lot of ground on allergic rhinitis. Are you ready to move on to some of these other fascinating topics?
Yeah, let's see what else is on the list.
Okay, that article, Allergic Contact Dermatitis, New Culprits, has me a little worried. It seems like there's a whole new world of allergens out there. I had no idea my harmless gel manicure could be a problem.
Yeah, the rise of methacrylates, which are found in a lot of nail products, is concerning. The article really highlights nail cosmetics as a major driver of allergic contact dermatitis these days.
So you're telling me my gel manicures could be causing an allergic reaction?
It's a real possibility, especially with at-home nail kits. The EU has even issued a warning that methacrylate-containing nail products should only be used professionally.
So DIY manicures might be more trouble than they're worth, but it's not just nail polish, is it? The article mentions all these other sources of methacrylates that you wouldn't even think of.
Yeah, absolutely. They're in everything from dental products and glucose sensors to earbuds and phone screens. It's kind of a reminder that these chemicals are becoming more and more prevalent in our everyday lives.
And that means more potential for exposure and allergic reactions. Okay, this next one blew my mind. Methylisethiosolina, or MI, is apparently in tons of products that we use every day.
Right. The article explains that it kind of became popular as a replacement for parabens,
Oh, right.
which were phased out because of concerns about their potential endocrine disrupting effects. You know, it's a classic example of unintended consequences. Trying to solve one problem sometimes leads to another.
Well, the article lists so many sources of MI. Household cleaning products, leather goods, children's toys, even those gel cubes that florists use. It seems like it's everywhere.
It is. It really is a reminder to read labels carefully and be aware of these potential allergens that are lurking in products that we think of as totally normal.
Right. And it's not just things that are, obviously chemical laden. Even stuff like essential oils can cause allergic reactions.
Yeah, despite that natural image, essential oils do contain compounds called terpenes, which can be allergenic. The article specifically calls out tea tree and lavender oils as common culprits.
Okay, I'm officially paranoid now. Is anything safe?
Well, don't panic just yet. The key is to be informed and take precautions. The article also talks about epoxy resins. They're becoming increasingly popular for hobbies and crafts.
Epoxy resins, those sound pretty industrial strength.
They were mainly used in industrial settings in the past, but now you can get them anywhere. The article even shares an anecdote about a 12-year-old girl who was hospitalized with facial swelling after working with resin crafts.
That's scary. It sounds like something you'd only encounter in a factory, not your own home.
Exactly. And it highlights the importance of taking proper safety measures when working with these materials, even if it's just, for fun.
Okay, shifting gears to something that can be pretty bothersome. Nocturnal leg cramps. Have you ever experienced those? Waking up in the middle of the night with that sudden horrible pain in your calf?
I can't say that I have, but the article points out that they're incredibly common, affecting about 40% of people over 50. It's not just an age thing, though. Anyone can get them.
Right. And the article differentiates them from restless leg syndrome, or RLS. With RLS, you have this urge to move your legs, and it actually feels better when you do.
Right.
With cramps, it's like a sudden, involuntary muscle contraction that causes this intense pain.
Yeah.
And sometimes it can last for what feels like forever.
And some medications, like beta agonists and spironolactone, can actually trigger those cramps.
Really?
Yeah, it's worth looking into your medications if you're experiencing these frequently.
Okay, so what can you do about it? The article talks about stretching and quinine.
Stretching is definitely key. The article actually mentions the study that showed calf and hamstring stretches done before bed can really reduce the frequency and severity of those cramps. As for quinine, it used to be a popular treatment, but it's not really recommended anymore due to safety concerns.
Interesting. Well, there's some good news. The article highlights a recent study that shows promising results for vitamin K2.
Yeah.
Apparently, people who took vitamin K2 had significantly fewer cramps than those taking a placebo.
The article even says that the vitamin K2 group had less than 1 cramp per week,
Wow.
compared to 3.5 in the placebo group.
I'm sold. Vitamin K2, it is. The article also mentions taurine for people with cirrhosis who get leg cramps, and it touches on magnesium, but the evidence for that is a little less clear.
Right.
Okay, let's talk about that article on semaglutide and tirzepatide. These medications have gotten really popular for weight loss and diabetes, but it sounds like there might be some potential eye complications.
Yeah, that's the main takeaway from this article. It's brief, but it does flag this as something to watch out for. It doesn't go into detail about the specific eye problems, but it does stress the need for more research and for people taking these medications to be very aware of any changes in their vision.
So if you're on these medications and you notice anything weird happening with your eyes, talk to your doctor.
Definitely. Better safe than sorry.
Speaking of unexpected connections,
Yes.
let's talk about that study on beta blockers and Huntington's disease.
Mm-hmm.
This is some pretty groundbreaking research, wouldn't you say?
It is. Just to give some context, Huntington's disease is a really, really devastating inherited neurodegenerative disorder. It causes this progressive motor, cognitive, and psychiatric decline. And there's no cure right now.
Right.
Treatment options are very limited.
So the fact that this study found this possible link between beta blockers and a delayed onset of Huntington's, it's pretty huge.
Absolutely. This study used data from this huge global research platform called Enroll-HD and found that people with what we call pre-manifest Huntington's disease, so people who carry the gene but haven't developed symptoms yet, if they were taking beta blockers, they had a lower risk of developing motor symptoms.
And for those who already had early-stage Huntington's, it was associated with a slower progression of those motor and cognitive symptoms. So it's not saying beta blockers are a cure, but it does suggest that they might have some kind of protective effect.
Right, exactly. And it's important to point out that this was an observational study, so it showed correlation, not causation. More research is definitely needed, but it is an exciting development that could potentially lead to new treatment options for a really, really devastating disease.
Wow. This deep dive has been full of surprises. Who knew that everyday products could be hiding all these allergens, that vitamin K2 could be a secret weapon against leg cramps, and that beta blockers might hold some promise for managing Huntington's?
Yeah, it's a great reminder that the world of health and medicine is constantly changing. What we know today might be different tomorrow.
And that's why it's so important to, stay curious, keep asking questions, and never stop learning.
Exactly. So what does all of this mean for you? We've covered a lot in this deep dive. From the complexities of allergic rhinitis to emerging allergens to the surprising potential of certain medications.
We hope you've learned something new and that it inspires you to take charge of your health.
Given the potential benefits of beta blockers on Huntington's disease progression, it raises an interesting question. Could other commonly used medications have unexpected impacts on chronic conditions? That's something to ponder, and perhaps something to discuss with your doctor.
That's a great point. It really makes you think about the big picture and how interconnected everything is when it comes to our health. Thanks for joining us on this deep dive. We'll see you next time. It really makes you wonder, are we trading one problem for another as we develop new products and treatments?
It's a valid concern. We have to consider the long-term implications of our choices, both on a personal and global level.
It's like that issue with MI replacing parabens. It seemed like a good solution at the time, but then
Yeah, unexpected consequences. It highlights the need for ongoing research and vigilance. We can't just assume something is safe because it's natural or because it's marketed as a solution to a previous problem.
exactly. We have to be informed consumers and advocate for ourselves, ask questions, read labels, do our research.
Absolutely. Knowledge is power, especially when it comes to our health.
Well, this has been quite a deep dive. We've covered so much ground, from the intricacies of allergic reactions to the surprising connections between seemingly unrelated health issues. What are your final thoughts?
I think the biggest takeaway for me is that everything is connected. Our environment, our lifestyle choices, the medications we take, it all plays a role in our overall health. And the more we understand those connections, the better equipped we are to make informed decisions.
I couldn't agree more. We've explored some pretty complex topics, but hopefully we've also given you some practical takeaways that you can apply to your own life.
Like remembering to stretch before bed to prevent those pesky leg cramps.
Exactly. Or being mindful of potential allergens in everyday products.
And maybe even having a conversation with your doctor about the potential benefits and risks of medications, even those that are commonly prescribed.
That's such an important point. We often focus on the intended effects of medications, but it's crucial to be aware of the potential unintended consequences as well. That's where open communication with your healthcare provider is so vital.
Definitely. And never hesitate to ask questions or seek a second opinion if something doesn't feel right. You are your own best advocate when it comes to your health.
Well said. We've covered a lot of ground today, and we hope you found this deep dive informative and engaging. Remember, staying informed is an ongoing journey. Keep exploring, keep asking questions, and most importantly, take care of yourselves.
Thanks for joining us.
Until next time, stay curious and stay well.